Yes, guys, I know. I've got a lot of energy today. You know why? Because I'm working nights today. It's almost 12 noon, and I want to show you guys a little bit about my day before I go to my shift. Look at Noah. He's driving me crazy today. Alright, what do you think of the haircut, guys? Yeah? You've seen the video at the beginning. Do you think the haircut is fine? Do you think I should get a barber? Or just save $40 a month? Instead of using a barber, I'll just use my clippers? That's how you save money out here! Daddy, what's wrong? You gotta get used to these vlogs, Daddy. You gotta get used to them. She freaked out. Hey, now, come on, Daddy. Sit down a little bit. What's wrong with you? What's wrong with you? Hey, Judah. What are you doing? The American flag? What about the Lebanese flag?
What's the Lebanese flag?
What's the Lebanese flag?
How does it look like?
How does it look like? Oh my God! That's the flag of your country, Daddy. Who is that?
Abraham Lincoln.
Who is that?
Abraham Lincoln. You mean this?
Yeah, who's that? What is that? Oh my God!
George.
Oh my God! Oh my God! Amani! Amani, what's going on with our children?
George Washington? George Washington?
Oh my God, guys. Oh my God! You've seen the title. Today we're gonna talk about MAs, CMAs, LPNs, and RNs. And hey, I'm gonna take you to my backyard a little bit. I gotta cut my nails before I go to work. But, hey, you're not the only one confused about it. It's not because you're an international nurse. It means that you are the only one who is confused about the role of MAs, CMAs, and LPNs. Hey, trust me, I've been in a class lately, and even nurses who studied and graduated from the United States don't know the exact role of MAs, CMAs, LPNs, RNs, CNAs, all the roles and types of healthcare professionals. So, bear with me, guys. I'm gonna explain it all to you, lay it down on the table so that once and for all, you'll know it and you will not be confused ever again.
This is what I say. I would cry. Oh, baby. I would cry. Oh, baby. Oh, baby. Don't you?
So what are you doing here, Noah?
I'm washing my hands.
You want to wash your hands? There you go. Hey guys, welcome to my backyard. I'm gonna clip my nails. Hey Noah, don't go too far, okay? Alright guys, I hope you're not hearing the wind. I put it on the mic so that I can give you better quality. I'm gonna clip my nails. You know how nurses, we need to be clean, right? I don't know how you girls do it. Like the female nurses, how do you do it with long nails? I can do it, I can do it. Alright, so let's jump into the RN role. By the way, before I jump into the RN role, hey now, say hi to the family on YouTube. Just say hi. Thank you, Noah. Oh, they didn't see you. Come here a little bit. Say hi again. Okay, now you can go play. Go play. Find some squirrels. Okay? Alright, guys. If you haven't subscribed to my channel yet, please go ahead and click that button down and subscribe to my channel. And if you like this video, please smash the like button. Hey, Noah, stay here, eh? Without further ado, let's talk about the RN role in the United States. Okay, and all this information you can find from your state's Nurse Practice Act. So all the information I'm giving you today, it's from the Illinois Nurse Practice Act. I highly suggest that you read your state's Nurse Practice Act to the T. I'm saying read every single word of it and understand it, because there's a little bit of difference between one state and another. All right, let's get into it. And excuse me because I'm clipping my nails. Hey, I said to myself yesterday, I'm not sure if it was yesterday. By the time you're watching this video, maybe it's a couple of days ago. I need to do a better job in being time sufficient, if that's a word. I don't know. I said I'm gonna be time sufficient. I'm gonna be time sufficient. Hey Jude, say hi to the YouTube family. Say hi.
Hi.
All right, guys. So I'm gonna clip my nails and I'm gonna talk to you about the RN role. Well, first off, the key components of the RN role. First off, comprehensive nursing assessment. Another key component is development of a nursing care plan, administration of medication, delegation of nursing intervention, provision of health education and counseling, evaluation of patients' response to intervention and to the care plan. Some of the things the RN may not do: initiate or alter an order which should come from a provider, hold ordered medication. Hey guys, trust me, this is very important. And you know, like overseas, if a patient is having high potassium, you would hold the potassium, or you will hold the aldactone. Or if a patient has low potassium, you will hold the Lasix. Hey guys, you've got to be careful. It's just one phone call away. Just pick up the phone, call your provider or your nurse practitioner or whoever can hold the medication, and just give them a call. They will allow it, and then you hold the medication. You can always postpone giving the medication until you get the order, but don't right click and hold the medication before getting an order. Period. Now, key components of an LPN role. An LPN in the United States is called an RN, but there are a little bit of differences, a little bit of things that she cannot do. So key components in the LPN role: collecting data and collaborating in the assessment of patients. When I say collaborating, it means that she has to collaborate with a BSN RN. Another component is implementing aspects in the plan of care as delegation. An LPN can delegate to a medical assistant, certified medical assistant, or a certified nurse assistant. Participating in health teaching, communicating and collaborating with another health service personnel. Monitoring existing IV infusions and discontinuing IVs as ordered. Initiating a peripheral IV if they pass the competency. Some of the stuff LPNs cannot do. They cannot triage patients. Initiate or modify the patient's plan of care independently. That's independently. Administer chemotherapy, initiating blood transfusion, and administering IV push medication. Now, key components in the CMA role: vital signs, medication verification, point of care testing, injections and immunizations. They can authorize medication refill as per protocol or provider's order. They can do order entry and give patient instructions. CMAs may not take symptom-based phone calls, refill prescriptions for controlled substances, provide allergy injections, provide any sort of triage or assessment, independently refill medication, independently provide patient education. Key components of an MA role: vital signs, medication verification, annual screenings, point of care testing, assist with prior authorizations, room patients, and set up and assist with procedures. MAs may not administer any type of medication, provide patient education or instructions, perform any sort of triage or assessment, and refill medication. I'm gonna talk a little bit about one topic, which is delegation. Hey, trust me, delegation is harder than you imagine. I mean, for me, since I came to the United States, I didn't even delegate one task. It's very hard for me to delegate, to ask people to do stuff for me. I prefer to do it myself and make sure it is done and documented. Period. But hey, delegation is a skill and you need to learn it, because when it gets busy and hectic, you need to delegate stuff. But make sure that the task is done and documented. So an RN will receive delegation from a provider or provider assistant. The LPN will receive delegation from a provider, provider assistant, or an RN. The CMA will receive delegation from a provider, provider assistant, RN, or an LPN. The MA will receive delegation from a provider, provider assistant, RN, LPN, or a CMA. There you have it, guys. I hope you got value from this information. But for now, let me continue clipping my nails.
Then I would cry.
If you like this video, please go ahead and give it a thumbs up. And if you're new to the channel, please do me a favor and punch that face down below to subscribe. And if you haven't watched yesterday's vlog, please click that video to watch it. Until next time, be an Alphaslice.